Hi everybody and welcome to our Fab Talks on the 2nd of August 2022. We've got the amazing Louise Hansford with us today, and I can't wait to have a great conversation with you because I know you're doing amazing things and I follow you on social media and all the things that you're doing. So do you want to just tell us a little bit about who you are and why you're here?
Thanks, Danny. So I'm Louise Hansford. I currently working on the Hep See You Later project, which is part of the NHS's Addiction Provider Alliance's response to Hep C elimination. It's a national project. It's very exciting. The NHS Addictions Provider Alliance, work across the country with 17 different NHS trusts to varying degrees, obviously, depending on which community services they've got. I got involved with Fab over the last couple of years because I saw the posts on social media and it seemed like a very good way of making a network and kind of building connections in different parts of the country that I wasn't familiar with. And it's been a real joy and a pleasure to be part of this network. I've got to know people that I wouldn't have known otherwise. I've got to learn about different NHS workings and different initiatives and all the fab work that goes on. So yeah.
Brill, and it's lovely to have you a part of it because you're so passionate and so dedicated that you can just, you're wanting to do everything, and it's great to see. And I think that's the good thing about the Fab Academy and the kind of networks that we have is, it's a new kind of family, isn't it, almost, of networks of what we can utilize, and rather than reinvent the wheel, we can see what the people are doing and take that on board. So very simply then, so what is hepatitis and why is it important to have the campaign and the program that you've got?
So hepatitis C is a blood-borne virus that affects the liver, and left untreated, a percentage of people will go on to develop cirrhosis and liver cancer. So it's classed as a chronic disease, a chronic virus. However, the good news is that there's treatment available. So Public Health England, who have now morphed into the UK Health Security Agency, estimate that between 50 and 65% of intravenous drug users have been affected by hepatitis C. And as we get better at treating people, obviously that number will lessen. However, in the media, like, hepatitis C can be kind of portrayed as solely an injecting drug user virus, and some people can then switch off and kind of not pay attention. But you might be aware that at the moment we're in hopefully the last stages of the infected blood scandal hearings and the compensation framework. So I first got interested in bloodborne viruses back in 1987 when I met my first kind of serious boyfriend called Duncan. He was a haemophiliac and he had been infected with HIV through blood products. And at the time I was 16, and when I did some research and all in the newspapers, it was like, hey, you're gonna die. So you can imagine it, for a 16-year-old, that was pretty scary. And I regularly went for HIV tests, and thankfully I didn't get HIV. Although again, similarly, there's lifelong treatment that's available and people can lead a very normal life now. It wasn't the case back in 87. I lost touch with Duncan, but I later found out that he also had hepatitis C. So hepatitis C pre-1991 was defined as non-A, non-B. So hepatitis basically means inflammation of the liver, and there's several reasons that you might get inflammation of the liver. So there's non-alcoholic fatty liver disease, there's alcoholic hepatitis, there's hepatitis B, which is a virus, and hepatitis A, which is a feces, oral feces kind of thing that people recover quite quickly from. It's a bit like food poisoning. But hepatitis B, 95% of adults clear that naturally. And there's also a very good immunisation programme for hepatitis B for people at a risk. With hepatitis C, there is no vaccine currently. So if you have got it, 20 to 25% of people clear it naturally, and the other 80 to 75% of people need treatment. So part of the reason I got involved with this is I was an intravenous drug user from probably 99 to 2001. I was injecting heroin, and at the end of my drug use, I've been left with a broken hip due to stigma and discrimination, basically. And I was very, very poorly, and I went into prison, and I've just recently met up with the nurse that did my Hep C test 21 years ago, and it was really emotional, because who knew the seeds that she planted then, 21 years later, I'd be doing this every day. So at the time I was diagnosed with Hep C, it was at that point I had osteomyelitis, I had a broken hip that had gone undiagnosed. There was lots of things going on, so it was the least of my problems. However, when I came home, I was very paranoid around my periods, around my toothbrushes, razors, and it was quite shameful, especially for a woman. So at that time, you had to be 2 years drug free to be referred to the liver specialist for treatment. At that point, it was interferon and ribavirin, which are used in chemotherapy drugs. So I was fortunate. I had a genotype. So genotypes are just a bit like tomatoes. So you have a plum tomato, a beef tomato, a cherry tomato. They're all tomatoes though. So Hep C genotypes in pre-2016, they did have a big relevance because the efficacy of the treatment was linked to what genotype you had. So I had genotype 2, so I had an 85% chance of clearing hepatitis C, and I only had to have treatment for 24 weeks. A lot of people had a really horrific time on that treatment. They told me I would lose weight. I was like, bring it on. And I didn't lose a pound, and I was devastated, absolutely devastated. But I worked all the way through it. I did my degree, and I maintained my life. To forward wind to 2012, an opportunity arose with Southampton drug action team. They recognised they had a Hep C problem, that people were starting to get poorly, so they commissioned the Hep C Trust to come down and do peer-to-peer education sessions. And I was working in Hampshire, and we sent 3 volunteers. When they came back, I said to my manager, hey, you don't know this. I'm in recovery. I've also had Hep C, and I'd like to see if we could set this up as a project. We've just literally a couple of weeks ago celebrated 10 years of that project, and it's won awards. I mean, it's just been phenomenal for something that was so traumatic for me. Like, the end of my drug use was very traumatic. The Hep C diagnosis was shameful. To be able to talk to people every day about hepatitis C, to break down the stigma and discrimination, and just really raise awareness. We're seeing a lot of people that so in Eastern European countries, that the unsterile tattoos, dentistry, cosmetic surgery, injecting drug use isn't the only transmission route. So, and I think the timeliness of the Hep C elimination agenda, which is a national initiative, where NHS England went into it was a pioneering partnership with pharma to do Hep C elimination. So you've got Gilead, MSD and AbbVie that have all got direct acting antivirals, which changed the landscape for the treatment. So instead of treatment for 24 to 48 weeks with, like, on the 48 week, you had a 45% chance of it clearing and really nasty side effects, to oral based tablets, 8 to 12 weeks, and very minimal side effects, if any. So it's completely transformed the landscape. And as part of the tender, the pharmaceutical companies had to say how they would reinvest some of their profits. So the NHS Addictions Provider Alliance went into a joint working agreement with NHSE and Gilead Pharmaceuticals, and Hep C Later was born. So yeah, that's in a nutshell of kind of a bit about Hep C and a bit about the project. We my colleagues and I, we coordinate the Hep C Later project. We've done high intensity test and treat. We've raised a profile. We've done innovation projects. We've done some incredible things. So yeah.
Wow, inspiring. It's amazing. And I can imagine it was quite emotional because, you know, when you think about that person and how pivotal they were in your life at that point and where you are now, you know, I can imagine it brought up quite a lot of memories and then quite a lot of emotions that came with that as well. Um, so, you know, good but emotional, I can imagine. Absolutely. So it sounds like the project is going really, really well. What is the project? What is it you're doing?
So we currently working with 14 NHS trusts, and we've got about 65 community drug and alcohol services in our portfolio. So as far north as Newcastle, as far the one way as Bristol down to Dorset, and as far the other way as Thurrock in Essex. So we basically we bring all those services together to share ideas, share innovation. We've got a strong data team. So drug services provide data to NTDMS, which is a national treatment data monitoring system. And they monitor the effectiveness of drug treatment. So you might have seen recently Dame Carol Black has done a big review of drug treatment, which is much needed, and actually it's been a breath of fresh air for somebody to kind of look at how much resources, financial and human, have just been. I mean, drug and alcohol services have been ravaged, Danny. So for everything's coming in together at the right time. So you've got Dame Carol Black, which has released 80 million back into drug treatment, which sounds a lot, but when you get it down to individual service level, it's not that much, but it's great, and we're really grateful. And so alongside that, we kind of look to get bloodborne viruses resourced properly. So we have each month our data gurus bring in some data and then create a Power BI dashboard, which shows we can reflect back to services to show how close they are to microelimination. And recently, we're really proud that Inclusion Visions Thurrock, which is one of inclusion services, were the first service to microeliminate hepatitis C using the new criteria. So my colleague Deanne and Laura and I, we sit on the Drug Treatments Provider Forum. And what I would say is when I set up the project in 2012, we weren't allowed to I wasn't allowed to talk to any other providers, because what we were doing was commercially sensitive, and it was the added value for tenders and for contracts. So the Hep C elimination, the lids have come off, and now we regularly sit with our peers in Change, Grow, Live, Turning Point, Humankind, We Are With You. We all come together to actually share ideas and to make sure that if a service user comes into a service in Bournemouth, they're going to get exactly the same offer as if they went to London, to Newcastle, to Leicester. And as a treatment sector, we've changed the way that we do things. You know, so the model that we've done with Hep C elimination, where everybody comes together and shares ideas and has open and transparent conversations about what's going well, but also what's not. I mean, the model can really be adapted and used to reduce drug-related deaths, you know, to reduce risk, like all sorts. So yeah, it's one of these things that when I'm a grandparent, whenever that might be, or a great grandparent in years to come, hopefully, that I look back and go, yeah, I was part of that, you know, because we've got a real chance to eliminate. So in Andover, we had a project called Accessing the Inaccessible, and they were the worst service in Hampshire for offering bloodborne viruses testing. They very much thought that it was a nurse-led task, and it just wasn't a thing. And Andover is an 84-mile round trip to Southampton Hospital, which nobody, you know, especially if you've got children, you couldn't drop your children off at school, do that trip on public transport and get back. So there were real health inequalities. It was real, you know, it was really unfair and unjust. So we put in a funding bid, and we took the hepatology nurses out to Andover. And do you know what, Danny? It's one of those career highlights, because from being the worst performing service, within 18 months, we'd treated 35 people. Everybody had been tested. It was a real community event, because the pharmacists, we would leave letters for the clients at the pharmacy. So when they went in for their opiate substitute prescribing, so methadone or Suboxone, the pharmacist would remind them of their appointment and send them over if they'd forgotten. I mean, we literally had 98 to 100% attendance rates every month. And again, you know, like at first people felt really ashamed that they got Hep C. And then on a Monday morning at 9 o'clock in the morning, we used to have 4 or 5 people waiting ready to see us. So they were like, oh, and they all knew why each other was there. And it really changed the dichotomy of the landscape, because people started talking about it. And when you expose things, that shame just dies. So we very much, we celebrate the successes. We've helped some services turn things around. You know, as you'll all appreciate, COVID was really difficult for the NHS. So when in the restoration phase, you know, it's another thing that services have had to do. So Deanne, Laura, and I, and recently Tony, who's come along as our training and development coordinator, we just go in and refresh, rejuvenise. And we work very closely with the Hepatitis C Trust, who are all guys that have got lived experience, because, you know, there's nothing more powerful than somebody going, I had Hep C and this is what happened. Do you know, the bit of my story that I didn't share is that I did Hep C treatment in 2007. I had an easy time of it. I didn't need to do it at that point. My highest ALT function, normal range is 0 to 35. My highest one was 67. There wasn't a medical need for me to do that treatment. If I hadn't, in 2012, when the osteomyelitis came back, I would have died, because the normal infection markers are 0 to 9. Mine were over 600. So for anybody that is watching this, if you've been at risk of Hep C, I would urge you to come forward and get a test, because we haven't got a crystal ball. You know, I didn't know in 2007 that in 2012 I would have life-threatening infections. So yeah, so Hep C later as a team, it's a fairly small team, and we, you know, when we take a step back, we've just recently published our impact report, and if anybody's interested, I can get our Hep C later lead Deanne to get that to you, because actually when you collate what we've achieved, it's absolutely phenomenal. So Deanne Birch is our Hep C later lead, and she kind of deals with the quite high level NHS trusts, brings them all together, does some problem solving, does some engagement, and much more. Then Laura Hughes and myself are Hep C later coordinators. So we've got services within our portfolio that we meet with monthly. We support with testing events, we support with training. So we've just recently had Tony Maloney that's come to our team, but he's a training and development lead. So one of our projects, we've worked with MSD on they've got some point of care Kefir machines. So they during COVID, the machines that they had weren't able to be deployed. So I grafted one of these machines, you know, all around the world at conferences when they were doing their stands. I was like, I want one. And we were privileged enough in 2020 to get one who we call Cindy. So you might have seen that on social media, Danny. So Cindy, because some of our intravenous drug users have got poor venous access, it's really traumatic for them going and getting the blood tests. This machine, you take finger stick blood into a cartridge. An hour later, you've got an RNA, so a virus result. It's transformed the landscape. So we've just recently had 2 new machines who we're calling Candy and Christine. So Tony will be very much managing the 5 Kefir machines, getting providers will get the most use out of them, how to plan events. And then we've got Candy Lincoln, who's also a Fab ambassador, she's the NHS Addictions Provider Alliance's manager, and she's also the project manager for Hep See You Later. Then we've got Eddie Taylor, who helps with the marketing and communication, and Rob Fair and Chris Heap, who are our data leads. So as you can see, it's a very small team, and I would have great delight in Deanne sharing with you the impact report, because it just shows when you get a group of passionate and committed groups together, we can absolutely nail things. And I guess a big part of our role is about getting the risk factors out there. So if you've had a blood transfusion pre-1991, please come and get tested, because as you'll see from the infected blood scandal, in England, we were using blood products from America that hadn't been screened. So one of, you might have heard of a lady called Michelle Tolley. She's one of the infected blood campaigners, and I've known her for several years now. She suddenly became quite unwell, was backwards and forwards to the doctors. Please look on the internet, because you'll get her story. Another lady that we worked closely with was a lady called Leslie, who did our original training with the Hepatitis C Trust. So over a 4-year period, Leslie became poorlier and poorlier and was backwards and forwards to the doctors and not really getting anywhere. She very much felt that the doctor thought she was a hypochondriac. So eventually she heard Anita Roderick on the radio talking about so Anita Roderick was the founder of The Body Shop, talking about the fact that she had a Hep C diagnosis, and Leslie marched into her doctors and demanded a test, and he said, "Oh, you haven't got any risk factors." And she said, "Well, I had a blood transfusion when I was pregnant, when I had delivered my son." And that was like 25 years previously, and it was on paper record. So sure enough, they did a blood test. She had genotype 1 hepatitis. She already had cirrhosis. My neighbour next door to me, obviously that's a neighbour, she went for a hip replacement in her late 60s. They must have done liver function tests and seen abnormal liver. Without telling her, they did a test for hepatitis C. She had had undiagnosed, untreated Hep C for 45 years. And she had been backwards and forwards to the doctor many times, and been diagnosed with depression, with anxiety, with lots and lots of different things, because left untreated, hepatitis C can give you like low energy, brain fog, like for me, like digestively. So pre-hepatitis C treatment, if I ate a fry up, I would feel physically very unwell. Now I can eat a dirty great fry up without feeling sick. So so definitely anybody that had a blood transfusion pre-1991, it is a big risk. Dental work, cosmetic surgery or tattoos, particularly abroad, definitely a risk factor. They are low risk, but nevertheless, for that 1 in 500 or 1 in 100, it can potentially be not life-changing, because treatment is available when you can get cured, but it can be definitely life impacting, especially when you've got to tell your loved ones. Sexually, it's blood to blood virus, so it's a microscopic bit of blood that's got to get into your blood system. So within sex, hepatitis B is sexually transmitted and found in bodily fluids. Hepatitis C is only in blood. So men who have sex with men are at higher risk because of the delicate nature of anal tissues. If a woman's on her period and the man's got a cut, that's a risk. Again, it is quite a low risk, because if you think with snorting cocaine or injecting drug use, I'm pushing something either into a vein or up a nose, where so yeah, and they're the main risk factors. So contaminated blood pre-1991, dentistry work, cosmetic surgery, or tattoos, especially outside of this country. Well, tattoos are still not regulated, and when we've done awareness events, like people say, Oh, well, I saw them, they used a brand new needle, and that says maybe, but what about the pot of ink that they've dipped needles into? So when you're going for a tattoo, make sure that you see them pour out of the bottle into a vial, and I'll ask the questions. Have any needles been dipped into that main bottle of ink? Because that's potentially, it's a microscopic bit of blood, and obviously tattoos, you're breaking the skin. So yeah, there's a wealth of information out there. Hep See You Later, I've got a very good and clear website. What I would say is, if you're going to search anything up about Hep C, use reputable websites. The NHS's information on Hep C isn't the greatest, and it isn't necessarily up to date. So the Hepatitis C Trust, HCV Action, Hep See You Later, INSHU, which is an international network, the World Hepatitis Alliance, I would strongly recommend those websites.
That's some really good information there for everyone, and we'll make sure we put some stuff up on our website when we upload the video as well to it for people to come catch back up on. So for me, when I was listening to what you're saying and just how passionate you are about it, is around the stigma. So we seem to have come a long way with a lot of things around stigma, around mental health, drug, alcohol addiction, things like that. Do you think we've still got a long way to go with hepatitis? Do you think there's still quite a large stigma, or do you think we're managing to break that barrier down?
I think we've done a lot of work, but actually there's still more to do, because people tend to think it's an injecting drug user virus. My youngest client has been 18 and my eldest client was in her 80s. Addiction, I think if we're honest, everybody can see some level of addiction in their life, be it addicted to social media, our mobile phones, chocolate, alcohol, work, sex, shopping. Everybody will have an area in their life that's out of balance. So for me, I chose to take drugs. I didn't choose the next 7 years of degradation and degradation. I went to grammar school. It wasn't on my life trajectory to end up in prison. One of the times I was in Crown Court, there was a girl, I didn't complete my A levels, but there was a girl prosecuting me that I'd done my A levels with, and that wasn't, it wasn't on my life plan. So I think there's a whole way to go, and interestingly, and I expect Vanda can put it in the chat, the NHS Addictions Provider Alliance, because it's such a massive thing, Danny. Last year we did our conference on stigma, and this year we're again doing it on stigma. It's quite upsetting when you hear how our service users are treated, and I think, yeah, it could happen to anybody. It really, really can. I mean, I've had such a diverse backgrounds of people, the stereotypical views, that it's going to be somebody with no qualifications, broken home. I didn't have a broken home. My dad held a gaming license. He was the manager of a casino. We, from the outside looking in, we were a perfect family. I wasn't sexually abused, I didn't have domestic violence, all that stuff, the adult, so the ACEs, the adult children adverse events, adverse child experiences, ACEs, I don't tick an awful lot of those. So I think there is still a long way to go. Absolutely. And the current research, one of my modules that I've done on my Masters in Public Health, I've looked at stigma, and even the language that the NHS does use, lost to follow up. That's quite stigmatizing anyway. Who's lost them? How have you lost them? Have you actually made the effort to contact them? DNAs, like judgments are made every single day, and the language, is quite shocking. How,
Absolutely.
so I would urge anybody, like our conference, I think I'm going to get it wrong, it's in November, but we've got some fantastic speakers, and I do believe that somebody close to our heart in Fab Academy may be doing our keynote It's one of our keynote speeches, but I think it might be embargoed at the moment. But yeah, so we really, you know, the need and the feedback after last year's conference was this is still a thing.
And I think you've hit the nail on the head there, though, because like when I think about it, so I've suffered with mental health for many years, and obviously do quite a lot around trying to reduce stigma and mental health. But actually, what I'm realizing now with my daughter and my son who's just been diagnosed with ADHD, the likelihood is I'm probably ADHD as well. And when I've looked into statistics of adults and self-medication around ADHD and ASD and things like that, actually what you're finding is a lot of addictive behaviors are already there and being built on. So again, the aces aren't there, the family life isn't necessarily the issue, but actually understanding that I don't drink alcohol now particularly or ever, purely and simply because I know I've got an addictive characteristic in me that when I start to drink, it becomes excessive. It doesn't just become 1 or 2 glasses of wine. It will become excessive. And I've been there, and I went to excess alcohol where I was drinking from the moment I woke up to when I went to bed at night, and repeated the cycle every day. And I think what we need to understand is when we're looking at addiction, that it's not, somebody doesn't wake up one day and just think, I'm going to do that. There is a set of circumstances that ends up in that line, whatever that might be, whether it's an addictive behavior, whether it's a diagnosis of ADHD or undiagnosed ADHD, or the ACEs that, we know people are at risk of going into criminal activity and things from there. And I think the work that you're doing is absolutely phenomenal. I watch you on Twitter all the time with all the things that you're doing. And I just think the more we can talk about addiction and the more we can talk about the kind of underlying issues of the stigma that comes from nursing staff and doctors just as much as it does from the general public, but actually educating the general public so that stigma's removed. Because like you've said, everybody thinks HIV and hepatitis is 1 or 2 ways of getting it and that's it, and actually the reality is there are multiple ways. And if we can educate with public health messaging that is the thing, then hopefully we can reduce the stigma alongside it, because people aren't going to be looking and going, oh, they've only got it because of, they must have done that.
Yeah, no, absolutely. I mean, our conference this year is tackling stigma in action, so visibility, education, and language. And I've got that many experiences of, I was going for a gynae op, and I was literally about to be wheeled into theatre, and the nurse went, oh, "We've got a high risk one here," and I went, "Excuse me?" She went, "Oh, it doesn't matter." I went, "No, please elaborate." And she got a bit flustered. And I said, "If you're referring to my Hep C diagnosis, if you read your notes properly, you'll see that I cleared Hep C last year with treatment. And whilst we're at it, shouldn't you clean the theatre just as carefully before me with the people whose statuses you don't know than the ones after me?" And the consultant walked through and he said, "This is highly inappropriate." And I did talk to him when I went back after for the outpatients appointment, and he said you'd be well within your rights to complain. And I said, I don't want to complain. I want people to realise the impact, because if that was somebody else, you're just compounding shame. And one thing to this day, Danny, which is my biggest regret in Hep C, is my friend had her second child. The midwife was in head to toe in white forensic suit and goggles. It was horrendous. And sadly, my friend relapsed and her children were subsequently adopted. So she can't even think back to their birth as a wonderful, pleasurable experience, because it was horrendous. And the best of it is, she doesn't have Hep C. She's the 1 in 20 that cleared it naturally. I could talk for the next 3 hours about personal experiences and other people's experiences. And I think when I started work in 2007, we weren't allowed to talk about our background. We weren't allowed to say anything. And if you said to me, "Oh, Louise, have you had an experience of addiction?" I'd be like, "Danny, we're not here to talk about me. We're here to talk about you." And it's quite so we've gone a long way. You know, the danger is that when I am talking to people, there are sometimes where the focus can be on the worker and the worker's experience, and just because I've had an experience of Hep C and addiction and crime and prison, it doesn't necessarily mean that I'm always the best person to help somebody. Far from it, because how I choose to recover and move on with my life is very, very different to other people's. Doesn't mean that their way's right and mine wrong, or vice versa. So I think services, by having that visible recovery, and thank you for sharing your experience around mental health, Danny, because that it just needs more people to stand up. That something I saw a few years ago was a video from America called The Anonymous People, and if people that go to 12-step fellowships for whatever reason, eating, sex, gambling, drugs, alcohol, cocaine, there's probably about 50 anonymous fellowships, all based on the 12 steps. If we keep totally anonymous, how do people know that there's life after addiction? How do people know that there's life after gambling, after, and so for me, there's something about that physical recovery, but it's also got to be meaningful. I really hate it when people tick a box. Oh yeah, I've got patient involvement, I've invited them to interview, or to interview staff, or we've run, it needs to be meaningful, because otherwise you're just compounding stigma. One of the things that we're really keen on is there's a drive to do testing for Hep C. And actually, if you're coming to me and you're genuinely at risk, I compound the stigma and discrimination if I manipulate you, or empower you, or motivate you, whatever the word you want to use is, to have a test, and you do because you want to please me. I'm saying I don't believe you. You're telling me that you've not shared injecting equipment, you've not done anything to put you at risk in the last 6 months. If I kind of win you round to have a test, I'm essentially saying you're a liar. Because why else would I? You wouldn't get sent for a diabetes test if you didn't have risk factors. You wouldn't get sent for a heart angiogram if I didn't have risk factors. So I think as a sector, one of the things we need to get better at is testing on a risk basis, and just making sure people are supported. I think listening to our service users. One of my biggest bugbears, I've got one little vein here, right? When I go to hospital, you've got nurses and phlebotomists that see me as a challenge. When I got rushed in with osteomyelitis, I was nearly dead with infection. My CRP levels were over 600. They gave me morphine, as they do in hospital. I had 47 different puncture wounds in my body where they tried to get blood out of me. Thankfully I was kind of like sedated, but that is really traumatic. If somebody's saying to you, this is where you're going to get blood, we need to listen to them. I am the expert of my body. I don't care what PhDs, what professorships you've got. I am the expert. I am fundamentally believe that our service users know what they need. We just need to use the, making every contact count training, asking pertinent questions, being non-judgmental. And I don't get me wrong, I'm not standing here saying that I'm totally perfect. I can trace one infection in the New Forest to 17 different people. And I had the opportunity to meet the one that kind of started it all off. And I imagined him to be quite, well, I didn't know I did this till afterwards, but I imagined him to be quite short, a couple of scars up his face. This is like 8-10 years ago, so that's my disclaimer. And I imagined him to not have many teeth. And I went to the service, and this very well built guy with a red jacket, hair all nice, very, very presentable, wouldn't look out of place on a telly show, said, "Oh, are you Louise? I'm here to meet you." And I looked at him and went, "Crikey, do I still do that?" So I didn't realise, but I still had, because I'd learned a bit about this guy from other people, and the fact that he was willingly sharing his Hep C with anybody. To his credit, he did tell them. So they had a choice whether they shared injecting equipment with him. But the desperation and the need to get those drugs inside people, like me, far surpassed the risk that they were going to be under. And yeah, I was quite shocked that I still did that.
I think we do. I think the unconscious bias, isn't it, of things that have perpetuated over our lifetime that gives us an idea of somebody or something and how we then portray them. And I think that's the thing about when you think of so I can think of stories of alcoholism and things where people who are alcoholics, especially functioning alcoholics, they're not the people who are on the side of the streets who are disheveled, who haven't shaved and smell and wee themselves all the time. There are some really prominent people who have been alcoholics and people who go to work every day and walk past you, but still when you think of drug and alcohol, you think of the no teeth, you think of the smell, you think of the lack of cleanliness, you think homelessness and steal, and thieves and things like that. And the likelihood is actually what you'll find is people who've got a lot more money will have just as much addiction issues as those with no money. And I think we had a story in an area and it hit the local news, where a gentleman had gone into a hospital for some treatment, was given a PICC line for that treatment because it was on long-term antibiotics, and he asked if he could have that PICC line kept in so that he could continue his drug use safely without having to use injectables. And it was declined for health reasons and obviously because of the risk of having a PICC line. And he actually sued the hospital because he said he was more at risk by removal of the PICC line than he was with the PICC line. And that person was not was actually a well-to-do businessman and was well known in the community, and nobody would have known that he was struggling with addiction on his own, because actually he had a very good job and was doing fairly okay, apart from the addiction and obviously mental health problems that come with that. But I think what can we do to help? So if somebody come up to you tomorrow and said, I want to do something that can help, what would you say to them?
I think it's about raising the profile so it can happen to anybody. Like the tramadol epidemic in America is a thing in this country. We've got a medicalized model. If you're ill, go give me a pill. There are hundreds of thousands of people in this country addicted to opiate painkillers. I think it is just the most powerful advocates are people standing up and saying this happened to me. You see it with mental health, you see it with gambling, you see it with bullying, with sports personalities. So I think it's about raising awareness, but also about challenging. So when there is language, so I did go a bit down a rabbit hole with my public health assignment, but actually it really got me thinking. I talk about loss to follow-up all the time. Actually, who's lost them? Like we've got like some of the patients that I'm dealing with now didn't even know they had appointments. So to call them lost to follow-ups is really disrespectful. So I think it's challenging the language. I absolutely, I think we've all got a duty to challenge stigma and discrimination. Like as part of the NHS overall values, we come in to be anti-discriminatory. We come in to not judge. We come in to show core conditions of genuineness, empathy, compassion. So I think it's kind of going back to basics and remembering why we do the job.
Absolutely. Just for the last few minutes, does anybody in the audience want to have any questions? Anybody want to come in and make a comment?
Absolutely, we do need to teach our children to be non-judgmental. It's really funny because when we were pregnant with our daughter, my husband and I had the chat, and at that point I didn't really want her to necessarily know that I had been an addict. We were never going to hide it from her, and she's been to our recovery meetings with us and conventions and campouts. And like the Hep C thing, it was really interesting. So when I did a Hep C video, which I've shared again on Twitter, it's a bit outdated because I talk about 13 years in recovery, and I'm now 19 years. You know, when I shared that originally on Facebook, I hid it from view from the school mums. And then I thought, well, I'm adding, you know, like I have got nothing to be ashamed about. But there was a fear that my story would impact Isabel and people wouldn't want her to play with their kids, because that's reality. And actually, when I did share the video, all the school mums commented on it. But there was one who drinks alcoholically that did avoid me at parties for a few weeks. So yeah, absolutely, we need to teach our children. My daughter knows all about Hep C. She's like, if you Google my videos or you look on my social media, you'll find the video. Like, we did 2 days of filming. She, you know, and her friends know I've been in prison. Her friends know that I've been addicted. So again, I think it's about that visible recovery from whatever it is, be it mental health. You know, it's really powerful, isn't it? Like all the cancer charities always use patients, because there's nothing more powerful than one person sharing an experience with other.
That's it. And we are all guilty of being judgmental. I think that's the unconscious bias that we're brought up with. And I think when you look at children who are playing, especially from quite a young age, there are no discrimination. There is no judgment. They play with, you know, everybody in the room. They don't think about who else, you know, is in the room, whether it's two mums, two dads, or different coloured skin, or you know, or anything. They have no inkling. And one of the things I learned very quickly is there was a young boy who was autistic in my daughter's class, and whenever the kids described him and they said, you know, the boy's name, they were like, you know, the one that wears the tartan shirt, or the one that has the blonde hair, or the one that sits in the corner, the one who has an extra teacher. Not once did any of the children say, oh, the autistic one, you know, which when we're as adults, we very quickly describe somebody, whether it's their hair color, their skin color, whether they are, you know, the convict, or you know that person. We're very quick to judgment, aren't we, in that respect, I suppose. And I think that's where we need to teach, where we need to kind of think about our language around children, so that they don't pick it up, because they are going to pick it up from around the adults that they listen to every day. And I think it's having those open conversations. And I think very quickly somebody will, as a child gets curious and asks those questions, we're very quick to go, oh, we don't talk about that, or we'll skirt around the conversation, or we'll pick up something else. And actually it's about having that conversation and saying, do you know what, actually they have been very poorly, or they have been in prison because of this, you know, that's what happens, that's a consequence. And actually teaching our children that, yeah, these things happen, but we don't, you know, dismiss it, and we don't ignore it, because actually the mental health of that person's only going to suffer the more that you do dismiss it and ignore it. And actually sometimes we just need to talk about it.
My eldest daughter's 29, and social media wasn't a thing that when she was 11, 12, 13. You know, my daughter now, my youngest daughter, who's 13 next week, you know, the influences of the internet and social media, I think that the kids now are exposed to so much. So yeah, we need to be on that. Band has just asked what my aspirations are for the future. So I definitely want to be around to eliminate Hep C. So we've got a NHS England want to eliminate it by 2025. Within drug services, we want to do it earlier than that. I definitely want to be around for that. I want to get my master's research project done, which again is a really marginalised group. It's I want to study people who've been so for years we've gone, no, you can't have Hep C treatment, you're using. No, you can't have Hep C treatment, you're homeless. Don't you know it's very expensive? No, you can't, you're going to go to prison. No, you can't, you don't stick to a script. To almost, because of this agenda, going, oh, Danny, you've got Hep C, here, have some drugs. And I question whose needs are going to be met. So I really want to, you know, like for some people that have got very chaotic lives, taking this tablet daily, I struggle to take my thyroxine daily, you know. So my aspirations very much are to in with my research project, my dissertation, to highlight the additional support for the people that are going to struggle to take the medication as prescribed, and also about the ones that don't want treatment, and about, as a sector, we need to respect that. And after this is done, I'm going to apply to do the public health consultant training. I got to interview before, but I failed the maths, so I'm obviously going to get a maths tutor to help me with that.
Fabulous as well. It's been absolute pleasure talking to you, Louise. I think you're an absolute inspiration, and anything we can do, anybody listening to this to help support that and reduce the stigma, you know, we're all there, and absolutely just watching you fly, because that's exactly what you're doing. So thank you very much for talking to me today. I like to end on a little bit of a quote, and I was trying to look around, and there's so many different quotes that I come across today, but actually one that I thought was quite apt was, "There is no shame in beginning again, for you get a chance to build a bigger and better than before." So I like that, because I think
that
it's
in the chat, please, Danny.
Yes. And I think that's true, because actually we have a lot of shame around a lot of our lives, whether it be, you know, our sexuality, our colour, or our skin, a diagnosis or not, you know, no diagnoses. And I think actually we need to remove that shame. So starting again is not shameful. So thank you very much. So today is the 2nd of August. I am Danny, and this has been our Fab Talks with Louise. So thank you very much.